Councillor Casey.
Thank you, Lord Provost. I just want to thank Councillor Hunter for bringing this very important issue to our full council today. Colleagues, many of us will have seen the recent Channel 4 news coverage of the current situation many of Glasgow's most vulnerable citizens are facing on a daily basis. This report truly shocking and indeed deeply saddened me. As Councillor Hunter has stated, Glasgow has a very serious outbreak of HIV, which public injecting and needle sharing has contributed to. It has been reported that HIV rate in Glasgow amongst drug users is expected to have trebled in the last 2 years, and there could be up to 1 in 10 drug users infected. This is the stark reality of what we are discussing here today. The situation has been compounded by the fact that the city's most used drug needle exchange in Glasgow's central station was closed by Network Rail against all advice and offers of support. This facility has shut just when Glasgow's very vulnerable needed it the most. As part of my role Chair of Glasgow's Begging Strategy Working Group, I've conducted a number of street visits and I've heard first-hand accounts by individuals who are public injecting of the issues and dangers that many of these citizens are facing on a daily basis. Many of them are understandably absolutely terrified. Regrettably, Glasgow has a significant population who inject drugs in public places. This is often, unfortunately, leads to discarded needles and other drug paraphernalia, which poses a significant risk to members of the public who may accidentally come into contact with them. Used needles discarded in some of Glasgow's hidden away corners will be all too familiar to us as councillors in here. I'm sure we get requests all the time to have them removed from various locations. Colleagues, we have a moral obligation to ensure we protect all of our citizens at all costs. The need for a safe drug consumption facility in Glasgow is required now more than ever, and I want to commend the work of the Glasgow Health and Social Care Partnership and other agencies have taken thus far in progressing this. Fortunately, last November, the Lord Advocate responded, indicating that he was not willing to grant an exemption in existing prosecution policy for a safe drug consumption facility, effectively denying Glasgow and Scotland the opportunity to lead the way in how we treat and ensure the safety of people who have sadly found themselves in this situation. A safe consumption facility would provide sterile injecting equipment. The facility would provide a hygienic space to use drugs under medical supervision. It would provide a medical care and emergency care in the event of any overdose. Counselling services and referrals to social health care and treatment services would also be available. The evidence shows that this approach works. Our partners, health professionals and even the UK Government's official advisors, the Advisory Council on the Misuse of Drugs, support setting up of a safe drugs consumption room. I'll finish on this. I urge, in fact, I plea the Home Secretary, Amber Rudd, to come to Glasgow and see and hear first-hand from not only those who support this proposal, but speak to those vulnerable Glaswegians who could benefit the most from this facility. Colleagues, there's too much at stake here. If we sit idly by and do nothing on this issue, people's lives are at stake. Please support this motion.